Hey, this is Dr. Tom Rogers on Monday morning talking about back pain, something that I've experienced a lot myself lately, and really through the past few years I've had some back pain off and on. Back pain is so common that it's something I think we need to talk about. One half, 50% of all Americans will experience back pain this year. It's something that cost our country, I think, something like $150 billion a year, 264 million lost work days. As a matter of fact, 80% of people have back pain during their lifetime that they'll have some problem with. So really, if you don't have some kind of back pain during your lifetime, something's really abnormal with you. I wish I was in that abnormal category, but I'm not. I'm in the normal category, unfortunately. As a matter of fact, this past year it got so bad I had to get an MRI of my back. And like most people my age, 65 years old, I have degenerating disc disease. Spondylosis is another fancy word for it. And I also have some scoliosis. My back is not straight. It doesn't have the proper curves in it. And it's kind of wearing a little bit. You know, I don't have any other risk factors for it other than being very active over the 65 years and no major injuries or anything. But there's probably some things that I would have done if I could have done them, and things that I'm trying to do now to kind of help my back. Besides going to a chiropractor, physical therapist, and I've even seen a couple physiatrists for this through the years. I've done a lot of exercises to try to strengthen my back. You know, when people say you have a weak back, I think that's exactly what it means. You have a weak back. The muscles have not been trained properly. Those core muscles in your abs and your back have weakened over the years. And so there's a few things I want to point out that may help you a little bit. Causes of back pain, besides being older and getting that degeneration of your spine, lifting too much, not lifting with your legs, lifting with your back, sitting. Sitting's just a terrible thing. Prolonged sitting. A lot of people call it the new smoking. It's definitely a risk factor for all kinds of diseases. So actually, and Ernie tells me that actually sitting puts a lot more pressure on your spine than standing does. So especially prolonged sitting is really bad for your back. I mean, have you ever noticed when you take a long car trip that your back is really stiff when you get out of the car? Sitting puts a lot of pressure, it loads up your spine, kind of almost like squatting does. You know, I used to do a lot of squats and deadlifts in the gym, and I certainly don't do those anymore. Maybe some air squats without any weight, but I certainly don't do any squats anymore. I wish I could. I just can't. Some people can. So lifting too much, sitting, bad sleeping positions. My back is stiffest in the morning when I wake up. I mean, it takes me a while to get it loose. And I wish I could sleep on my back. I've told people over and over again, sleeping on your back, which it turns out only about 15% of people can actually do, can help you if you sleep on that back with a pillow under your knees. And if you sleep on your side, which is the second best sleeping position, put a pillow between your legs, your knees, and sleep on your side if you can. If not, just a pillow under your knees would really help. I end up, I think, sleeping on my stomach a lot, and it's a really terrible position for your back. And your mattress makes such a huge difference in the way that you treat your back. You know, people say you need a pretty hard, stiff mattress, and it's probably true. So if you're having back pain like me when you wake up in the morning, please look at your mattress and switch to another mattress. My dad used to say there's two things you should never skip out on in your life or wince out on. It's your shoes and your mattress, because you're going to spend most of your lifetime in one or the other. So get a good mattress and experiment with it around a little bit. Another risk factor, of course, is something I treat daily, and I have a campaign that I try to cure in my patients is obesity. When you're carrying around a lot of weight, it just puts too much pressure on your knees and your back, and it leads to a weak core. So it turns out most back problems are mechanical, meaning it's not really life-threatening. It's caused by the things we just talked about: poor mechanics, poor posture. Other rare causes are things like inflammatory arthritis, infections, fractures, even cancer. If you have prolonged low back pain that's unexplained, you need to pursue that with a doctor and make sure it's not an occult cancer. It's rare, but it happens. So when do you see a doctor for this? I mean, everybody has back pain. When do you need to go to the doctor? Well, if this thing persists for weeks and months, maybe if it's not better, if you treat it with nonsteroidal anti-inflammatories, rest, ice, heat, if it's just not getting better, or especially if the pain or numbness gets in your legs and feet, then you may have a disc problem, an extruded disc, or nerve pain, neuropathy. So you really have to kind of look out for that. And if you just can't walk without pain, you need to really think about maybe getting at least a plain x-ray of that back and making sure that you don't have anything else going on any worse. And I've had my back plain films and MRI to see what it looks like, and it's pretty interesting to look at the way the nerves are impinged in my case. Fortunately, all my pain's in my back. I don't have any in the legs, but my wife has it in the legs, and she has quite a problem with hers too. Treatment, proper sleeping positions, nonsteroidal anti-inflammatories, maybe muscle relaxers. Sometimes creams will help. CBD creams sometimes help. CBD oil really kind of helps my back. I tend to like the anti-inflammatory Mobic, which is a once-a-day thing. Again, I don't like to take any medicine on a chronic basis. I certainly try to stay away from inflammatory foods, and I take a supplement called turmeric or curcumin, which is an Indian spice that really helps any kind of inflammation. And I try to strengthen my back with certain exercises. Again, like I say, it's the core strength that you need to prevent a weak back or back pain. And that includes doing a lot of bridges or planks. You can even get on something called the Roman chair at the gym, that you hook your legs underneath, put your stomach underneath the pad, and it's like your body raises up like that slowly. And that's probably the best strengthening exercise for your low back. But you got to be careful. If you have back pain, this is very hard to do, and it's only for people that want to prevent back pain. It can make your back pain worse. I like yoga a lot, but you got to be really careful that you don't do a lot of forward flexion in yoga, and you can really hurt your back in yoga. So be careful with doing easy yoga. If you're already having back problems, let the instructor know you're having problems, and do some easy stretches. And I like hot yoga because everything's really loose and warm. You're sweating. Your back feels better in hot yoga. But I'm telling you, with yoga, you got to really be careful. You can really mess your back up if you don't know what you're doing with the yoga. The knee to chest exercise is pretty good. I try to do that every morning before I actually get out of bed, and rotate it a little bit. There's a couple exercises. One is called the cat stretch. That's where you kind of stretch your back up and then go that way. Cat, dog, cat, dog. Superman's where you lie on an exercise ball and act like Superman, like you're flying with your arms out and your legs if you can get them. And Mckenzie exercises for back rehabilitation are really good. Talk to somebody like Ernie for those. I think walking is good for your back. Running seems to be really tough on backs. I just don't run anymore for any length. I wish I could, but I just can't. It pounds my back too much and my knees at a certain age. Running's a great physical thing, especially for mental, but it can be bad on joints for sure. For some reason, I can bike for miles and miles without any problem at all. It's more of a non-weight bearing thing. And swimming's great too, even if you can just float in the pool. I like infrared saunas. I like hot tubs that are warm and have those jets on your back. And that's something you can do. So try to get your back, do all those things you can do to prevent back problems as you age. Start thinking about this early. If you're already into back problems, which probably most people that watch this have had back problems, then you can do some of those things I talked about. There's also a lot of other treatments for this, like epidurals, facet joint injections if it gets really serious, microneedling, acupuncture, which I've had. I use a lot of heat on my back. There's cupping that you can get on it. So there's a lot of cool things you can do. Stem. I have my own portable stem unit that I put on my back when it gets really flared up and starts spasming a lot. So I like stem on my back a lot. So, and I try to maintain my posture. I have found that the back braces don't really help me much at all, because I want you to strengthen your own core, not rely on a back brace to stand up straight. So back pain, reason for a lot of doctor visits. It's just can be a chronic condition. If it gets acute, you need to seek treatment. If it's persistent for a long period of time, you need to seek treatment and realize there are ways you can strengthen your back and prevent that stiffness and pain that so many people have, because it can be quite debilitating. And you'll learn this as you get older, and you get some of those degenerative disc disease like I have, and then pinched nerves. So it's something you need to start thinking about. And there is great treatment for it, and there's hope for it. Rarely do you have to get surgery, but occasionally surgery will cure a ruptured or extruded disc almost overnight. So don't forget to do the proper things with sleep patterns, posture, avoid prolonged sitting, get early treatment for your back. Don't let it persist for months and months without seeing a doctor for this. So I hope you learned a lot. I'll see you next Monday. Thank you.